I chose Coastal Vision because the surgeons here came highly recommended from all of the people that I play golf with and the other doctors that I play golf with. I was talking about how I wanted to see a little bit better and how contacts bothered me after a long day of golfing, and so they recommended Coastal Vision as one of the top groups in the country.
Dr. Dan Tran. I am the founder of Coastal Vision. The philosophy that we have with Coastal Vision is that basically, if you look at our logo, if you look at our tagline, it is technique, technology, and trust. So we are providing the latest surgical technique with the best possible skill of the surgeon, using the latest technology, and combine them together to earn the trust of our patient.
What I really love about the doctors at Coastal Vision is that we share the same passions for the latest technology, passion for delivering great patient care, but also passion for doing the right thing.
Coastal Vision's surgeons are all excellent in their field. Patients enjoy dealing with them, and they're very good about explaining things to the patients and making the patients comfortable. Their surgical work is absolutely outstanding.
Post-surgery, my vision's been amazing. Right after the surgery, he had said, you might feel uncomfortable for like a day or two, but I woke up the next morning and I could see perfectly.
Ophthalmology is a field that happens to rely heavily on technology. You really need the technology to capture the disease, to diagnose it, otherwise you can't treat it. And once you diagnose it, you really need advanced technology to treat it. And I think that's really what differentiates Coastal Vision from other clinics.
I absolutely feel they're at the cutting edge of technology. Dr. Tran is constantly attending conferences. He often travels to Asia to perform surgeries that are not able to be performed in the US yet, so I feel that they absolutely know what's on the forefront of all procedures and technologies.
I tell my patients to come to Coastal Vision because I am really happy with the care they receive when they come to Coastal Vision. They're treated like a family member by the surgeons and by the staff when they come here.
Overall, my experience with Coastal Vision has been remarkably positive. From the moment that I went in, I was really greeted really warmly, and even all the way throughout the recovery and even through the actual procedure itself, it really gave me confidence that they knew what they were doing and I was really with the right team.
The reason we choose Coastal Vision for our patients, the technology, yes, it's wonderful, but we can get that in multiple places in an area like Orange County. It's the quality of the surgeons, it's the care that they give to our patients individually, and that's priceless.
We believe that we should treat our patients like our family. We will offer the best quality of care to you. We will individualize our care to each patient. We believe that no one is exactly the same.
I think what makes Coastal Vision unique is their attention to detail. So following up with patients, making sure everything's prepped before surgery, top-notch service, top-notch doctors, top-notch results.
You can't put a price on your safety, your peace of mind. It was the best experience of my life, the best investment of my life. I would do it again in a heartbeat.
You've decided to have a vision correction procedure to help you see clearly without dependency on contacts or eyeglasses. But where should you begin? This video will explain the options currently available to help you decide with your eye doctor which one might be best for you. In order to see clearly, the eye must focus incoming light onto the retina at the back of the eye. If light does not focus on the retina, the eye may be nearsighted, farsighted, and/or have astigmatism. There are several vision correction solutions that help refocus the light, enabling the eye to see clearly. Glasses or contact lenses have traditionally been used to achieve clear vision, but today there are other permanent vision correction options available. A doctor may use a laser to correct your vision with procedures called LASIK, PRK, or SMILE. Or the doctor may use the EVO ICL technology to correct your vision through the addition of a lens. Here is a brief description of each procedure. LASIK surgery begins with anesthetic drops applied to numb the eye. Next, the doctor will use an automated device to create a thin flap of tissue on the cornea, the clear front window of the eye. The doctor will then lift this flap and hinge it back, out of the way. Then, the doctor will align the laser beam with the eye and supply laser light pulses to remove tissue and permanently reshape the cornea. The laser will be programmed with the information gathered in the preoperative exam. Finally, the surgeon will reposition the flap, smooth it with a medical sponge, and allow it to dry for a short time. With LASIK, clear vision can be achieved, and recovery usually occurs quickly. PRK is similar to LASIK and also corrects vision by reshaping the cornea using a laser. First, anesthetic eye drops will be used to numb the eye. Next, rather than creating a flap, the surgeon will remove the epithelium, which is the thin layer of protective cells that covers the cornea. Then, as with LASIK, pulses of laser light will be delivered to reshape the cornea. With PRK, excellent vision can be achieved. However, recovery takes more time, generally 2 to 3 weeks due to healing of the cornea surface cells. With both LASIK and PRK, nearsightedness, farsightedness, and astigmatism can be corrected. LASIK and PRK may not be ideal for people with high levels of nearsightedness or those with irregular corneas or dry eye concerns. SMILE is another laser vision correction procedure that permanently reshapes the cornea. During the SMILE procedure, lasers separate a disc-shaped piece of corneal tissue from itself. The disc is then removed by the surgeon through a small incision. With SMILE, nearsightedness and astigmatism can be corrected to achieve clear vision, and recovery usually occurs quickly. Instead of removing corneal tissue with a laser to reshape the cornea, the EVO ICL is an additive lens-based technology that delivers sharp, clear vision both day and night. First, anesthetic eye drops will be used to numb the eye. Next, a tiny opening is made in the cornea, and the EVO ICL is folded and placed in the eye. The lens naturally unfolds, and the doctor will tuck the edges of the lens behind the iris. With the EVO ICL, patients experience a quick recovery and have the added peace of mind that the lens can be removed at any time by a doctor. Unlike a contact lens, there is no maintenance needed, and once in place, patients cannot see or feel the EVO ICL lens. EVO is for patients who have nearsightedness with or without astigmatism, and may be an option for patients that have been told they are not candidates for laser vision correction. LASIK, PRK, SMILE, and the EVO ICL procedure can each provide excellent visual results, and overall, these vision correction procedures are typically quick and painless. Laser vision correction procedures are permanent. While the EVO ICL is designed to be permanent, it can be removed or replaced by a doctor if needed. Thank you for taking the time to review your vision correction options. LASIK, PRK, SMILE, and the EVO ICL procedure offer unique advantages for patients wanting to eliminate or reduce their dependence on glasses and contact lenses. Your doctor will explain the risks and benefits of each procedure to help determine which one may be best for you.
ZEISS SMILE Pro is a very non-invasive procedure where we use a very gentle laser, very quick laser, fast.
There's 3 main advantages I think of when I'm thinking of SMILE. Number 1, less risk of dry eye. Number 2, it's a flapless procedure. And number 3 is a lifestyle choice. For my patients that are really living an active lifestyle, we choose SMILE.
You can have the procedure and you can get up and you can go back to your normal activity the next day, or for that matter, the next 10 minutes.
I started wearing glasses when I was 4 years old. I didn't know I needed to wear glasses, and I hated wearing glasses. They actually had to force me to put glasses on during school. Growing up, I was very active. I played volleyball. I taught yoga for 2 years before I went to optometry school. So it wasn't terrible, but it definitely was inconvenient after the end of the day to wear contact lenses. I decided I wanted to have refractive surgery and get rid of glasses and contacts when I was around 25 or 26. I went in for a consult and I found out that I wasn't a great candidate for LASIK. My corneas were very thin and I had a high prescription and a lot of astigmatism. Because I wasn't a great candidate for LASIK, I found out about the EVO ICL procedure, and I learned that it was an additive procedure and there were a lot of benefits to EVO. When I decided to get EVO ICL, I of course chose Coastal Vision to have my procedure done at. And I chose Dr. Dan Tran, who just happens to be my dad, because he's super experienced in all types of refractive surgery. He worked with a ICL company since it began, and I knew that as a surgeon he would take really great care of me.
As you know, Dr. Stephanie Tran is my daughter, and she approaches me and asks me to perform the EVO ICL for her to correct her vision. The EVO ICL is a newer design of the ICL, and with the newer design of the ICL, it makes the procedure extremely easier to do, more comfortable for the patient. After we finished the first eye, which is the right eye, the first thing I heard from my daughter is, "Wow, I can see so well," right away, which is in a way that's even faster than LASIK. Even though I'm expecting that, having to hear that from my daughter also on top of that is very gratifying.
Since I had the EVO procedure with Coastal Vision, my life has totally changed. I actually didn't expect it to be that more convenient for me, but just having to put glasses on to see at night and put the contacts on early in the morning and have some dryness at the end of the day, I didn't realize that it actually impacted my lifestyle. And so now I can just wake up, roll out of bed, go work out, have a whole work day, go to a work meeting at night, and come home at 11 p.m. and my eyes feel great. So I would 100% do it again.
An important advancement in cataract surgery is the introduction of the refractive cataract laser. This has helped make the procedure safe and guided surgeons to deliver better outcomes. Many surgeons choose to perform advanced laser cataract surgery to help patients reduce their dependence on glasses after surgery. This is because LENSAR's precision and sophisticated imaging technology provides tailored treatment planning and helps surgeons correct a patient's astigmatism at the time of cataract surgery. We'll discuss this more later on. In this video, we will look at the differences between a manual cataract procedure and a laser cataract procedure using the advanced LENSAR laser system. This will help you better understand your options so you can talk with your surgeon about the right procedure for your visual needs. As you age, the lens in your eye can become cloudy, making it harder for you to see. During cataract surgery, the cloudy lens is removed and replaced with an artificial intraocular lens, or an IOL. During a manual cataract procedure, the surgeon uses a blade to make incisions in your eye and create an opening in the capsule to get access to the cataract lens. This is a critical step in cataract surgery because it can affect how a new implanted lens will be positioned in the eye. If it's not done with high accuracy, the position of the lens could be off alignment, which may affect your vision after the procedure. The next step in the procedure is the removal of the cloudy lens. During a manual cataract procedure, the cataract is broken up into small pieces in preparation to remove it. A handheld instrument may be used first to break up the lens into a few large pieces. Then ultrasonic energy is used to break it up into smaller pieces before it can be suctioned out. It's important to note that when less energy is used in the eye to remove the cataract, the quicker your vision will recover. Less energy also reduces the chances of complications. After the cloudy lens is removed, a new IOL is placed into the capsule, where your natural lens used to be. Opting for a laser cataract procedure with the advanced features of the LENSAR laser system provides more precision and accuracy during the critical steps of the procedure. The LENSAR laser system's advanced augmented reality technology is a unique imaging system that provides your surgeon with a 3D view of your eye. This allows for more detailed information and treatment choices during your cataract removal procedure. With LENSAR laser cataract surgery, the capsule opening is created first. Guided by LENSAR's detailed image, the surgeon accurately places the laser spots in a circular pattern to create the opening. Because the laser allows for such accuracy during the capsular opening, positioning of the new IOL can be optimized, which may lead to an improved visual outcome. The next step is to soften the cataract to make it easier to remove. The instruments used in manual surgery are replaced with a precise and accurate laser. This helps to minimize the need for ultrasonic energy to break up the lens, and in some cases, LENSAR has entirely eliminated the need for ultrasonic energy. This may reduce the risk of certain complications and potentially speed up healing time. After the lens is softened, the capsular opening can easily be removed. Once the cataract is removed, the new IOL is placed inside the capsule. If you have astigmatism, it can also be corrected during your cataract procedure by making tiny incisions on the eye to reshape it, or by adding a special IOL, called a toric IOL. Astigmatism is a highly common condition that happens when the eye is shaped like a football instead of like a baseball. It affects your near and distance vision, causing blurriness or double vision. Your surgeon can now use the LENSAR laser to help guide treatment of your astigmatism during your cataract surgery, thanks to the advanced features of the laser system. Depending on the amount of astigmatism you have, your surgeon may use the laser to create small incisions on your eye to reshape it. These incisions can be made more precisely with a laser compared to manually making them with a blade. If you have a greater amount of astigmatism, your surgeon may recommend a special or toric IOL to correct it. The LENSAR system helps your surgeon to precisely align the toric IOL where it needs to be. Because of how a toric IOL works, it must be accurately aligned in the eye in order to provide the best visual outcome. In a toric IOL manual procedure, proper alignment relies on hand-drawn ink markings made on the surface of the eye, which can run or fade during the procedure. Any inaccuracies can lead to misalignment of the toric IOL and may affect your vision after surgery. LENSAR helps eliminate any potential alignment inaccuracies, giving you the opportunity to restore your vision to its full potential. By choosing LENSAR laser cataract and astigmatism surgery, you are choosing the most advanced procedure possible, so you can rest assured knowing you have the latest technology available to treat one of your most valuable senses, your sight. Ask your eye surgeon about how you can choose the LENSAR laser system for your cataract and astigmatism procedure.
I'm Dr. Ashley Aoyang. I'm one of the optometrists at Coastal Vision, and I'm here to answer some common questions that we get from patients in our office. The light adjustable lens is a new innovative intraocular lens that's used during cataract surgery. The thing that sets it apart from traditional lenses is that it can actually be adjusted after the cataract surgery. So this really allows us to tailor and personalize patients' visions after the surgery, using their feedback and taking into consider their lifestyle to give them the best vision possible, potentially reducing or eliminating the need for glasses or contacts after surgery. So the light adjustable lens works by focusing controlled UV onto the lens to change the shape of the lens in order to correct the prescription. So for most patients, they're going to require about 3 to 5 visits to the office after their cataract surgery once they're healed. Usually patients will have 1 to 2 treatments, and once we've finalized the customization of the vision, patients will no longer have to wear the UV protecting glasses after surgery. The benefits of the light adjustable lens is that we're able to provide highly tailored and customized vision for each patient. So we're going to take into consideration lifestyle, visual demands, hobbies, how patients use their eyes in order to give them the best vision possible.
Nearly all adults experience cataracts as they age. Cloudy vision and colors that appear dull are the most common symptoms. Cataracts are treated with surgery that replaces your natural lens with a clear, artificial one. Before choosing an artificial lens, you should know that lenses fall into 2 basic categories: fixed or adjustable. Like a pair of glasses, all lenses have a prescription. For a fixed lens, that prescription is determined before surgery while you still have cataracts. Once a fixed lens is implanted, the prescription cannot be changed without additional surgery, even if your vision is not ideal. Unlike a fixed lens, an adjustable lens can be changed after surgery. Once your cataracts have been removed and your eyes have healed, you can test drive your vision, adjusting it up to 3 times until your final prescription is right for you. The light adjustable lens is the only lens you can test drive and then customize after surgery. Ask your doctor if the light adjustable lens is right for you.
So my procedure wasn't really meant to kind of correct the degenerative eye disease that I had, but I think it was a slight chance that it would correct it, and I feel like it has. Right after my surgery, I had noticed that the symptoms that I had before, which was kind of like blurred vision and kind of like double vision and really just kind of a ghost effect with my vision, started to disappear. So when I went in for my routine checkup, they let me know that they showed me a topography of my eye, and they showed me kind of the bulging of my cornea. And they said, hey, this is a little bit more serious than just having corrective eye lenses or just corrective contacts. And so that's kind of where they referred me to Coastal Vision. And I did a little bit of research too about just Coastal Vision before I went there, but that's really how I was introduced to Coastal. From the moment that I went into that Irvine office, I was really greeted really warmly. To the first specialist that I went to, kind of broke down all the tests that she was doing on me, and then she passed me over to Dr. Tran, who kind of introduced the procedure to me and let me know, hey, this is what the procedure would look like, here's how your recovery would look like as well. And so it really gave me confidence that they knew what they were doing and I was really with the right team. Yeah, would I recommend Coastal? Absolutely. The staff, I think the credibility that they have, I think the technology, I think just the amount of care that they take into their patients is something that I would definitely recommend to my friends and family.
Presbyopia is the frustrating loss of sharp close-up vision that comes with age. Beginning in their 40s, people usually find they have to hold reading materials farther away to be able to see them clearly. This is due to normal changes in the eye that make it harder for us to focus on near objects. When we are young, the lens in our eyes is soft and flexible and easily changes shape to focus on objects close up or far away. But at around age 40, the lens becomes more rigid and can't change shape as easily as it once did. That makes it more difficult to focus at close range. Those magnifying eyeglasses we call readers are the most common solution for presbyopia. However, many people find it annoying to have to constantly take them on and off depending on what they want to see clearly. Wearing bifocals offers relief for some, though many people would prefer not to wear glasses at all. For some people, monovision may be the solution for having clear vision at most distances and reducing dependence on glasses. Monovision is a technique that corrects vision in one eye for clear distance vision and the other eye for clear near vision. Monovision can be achieved with contact lenses, refractive surgery, or with artificial lens implants that replace the eye's natural lens. In each case, one eye is set for good distance vision, while the other is set for good vision close up. Your dominant eye is usually the one corrected for distance vision. With monovision, the eye that sees distant objects clearly will see close objects as slightly blurred. The eye that sees well up close will see distant objects as blurry. The brain learns to adapt to using one eye or the other, depending on the task at hand. It may sound difficult to adapt to monovision. However, many people eventually find that when both eyes are open, they don't even notice which eye is set for distance and which provides near vision. If you are considering monovision, your eye doctor may recommend trying it with contact lenses first to see how well you adapt. It may take a few weeks or a few different adjustments to determine if monovision is right for you. Some people who try monovision may find that things in the distance are slightly blurry. Other people may be disappointed to find their near vision isn't quite as crisp as they had hoped. Also, your depth perception or the ability to judge the distance of an object from you may be affected. If wearing bifocals or reading glasses for presbyopia bothers you, talk with your ophthalmologist. He or she will ask you about your vision needs and expectations. Monovision may be a solution for you to reduce your dependence on glasses. Also, if you have any questions or concerns about your eyes or your vision in general, don't hesitate to bring them up. Your ophthalmologist is committed to protecting your sight.
My name is Dr. Betsy Nguyen. I am a cataract and glaucoma surgeon here at Coastal Vision. The goal of glaucoma treatment is to lower the eye pressure. It's like lowering the blood pressure in the body, but lowering the eye pressure in the eye. And we do that so it decreases the chance of you losing vision over your lifetime. In the past, we only had glaucoma medications and more invasive glaucoma surgeries, but over the last 10 to 15 years, there's been amazing change in the technology of the types of surgeries we can offer for the patient. It is called MIGS, which stands for micro-invasive glaucoma surgery. And these are different types of glaucoma surgeries that are usually typically only 10-minute surgery in the operating room. The patient will heal very quickly, for probably 1 to 2 weeks. And also, we can treat glaucoma in the earlier stages. In the past, we reserved the glaucoma surgeries just for the severe stages of glaucoma. But wouldn't it be great if we could intervene much earlier so that they will not lose vision during their lifetime?
EVO ICL is a refractive procedure. It's a lens-based procedure where the lens is implanted behind the surface of the eye, and it's different than laser-based procedures because there's no tissue removal. So it's all additive, and it also has UV protection, which is nice because if you go outside, then your eyes are actually protected from the sun.
The EVO ICL Collamer lens, or EVO for short, is an implantable lens that can correct common visual limitations like nearsightedness, freeing you from glasses and contacts while harmonizing with your natural eye. EVO's Collamer material contains a small amount of purified collagen, and the remainder is made of a similar material to that found in soft contact lenses. The EVO lens is soft, flexible, and biocompatible, which means the lens is stable inside the eye. Let's see how this quick and safe procedure works. Before your procedure, your doctor will perform a series of standard tests to measure the eye's unique characteristics. When you arrive for your procedure, your doctor will administer eye drops to dilate your pupil as well as anesthetize your eye. The procedure follows 3 steps. Step 1. Your doctor will create a small opening at the edge of the cornea to insert EVO. Step 2. EVO is folded and inserted through the small opening. Step 3. Once EVO is inserted, the doctor will make any necessary adjustments to ensure its proper positioning in the eye, securely placing it behind the iris, the color part of your eye, and in front of the natural crystalline lens. EVO is not visible to you or others. EVO ICL works in harmony with your natural eyes to provide exceptional quality of vision. Take the next step toward visual freedom. Find out more about EVO from your doctor.
Not having your eyesight for the last 2 years was very difficult for me. And making this decision has really changed my life.
Aw, Icky. Aw.
Are you really speaking? For the past 2 years, I've had issues with my eyes. So it was on-site cataracts, and my doctor said that I needed the procedure. And so I thought very hard on it when I was ready for the surgery. And so I decided that it was this year because I was having difficulty seeing. Even though I live in Hawaii, I decided to use Coastal Vision because of all their new technology that I've heard of. I heard that Dr. Tran is one of the best surgeons to have cataract surgery, and he did my surgery, so I'm very happy with it. Well, the decision to get cataract surgery came pretty quickly because the past 2 years I've been having issues with my eyes, and it was time to get them done. And I came to Coastal Vision, and just not having to wear my glasses and be able to wear in 2020 to see 2020 now is fantastic. Because once you don't have your eyesight, which, you know, the past 2 years was very difficult, that having the freedom to see clearly and then coming here to Coastal Vision was the best decision I made.
Cataract is a common eye condition affecting millions of people, usually as they get older. A cataract is when the normally clear lens inside the eye becomes cloudy. Vision becomes dim or blurry, and driving at night may be more difficult. Things may appear less bright or colorful. Normally, the eye's lens is clear, allowing light rays to pass through and focus as they should on the retina. As a cataract forms, the lens gradually becomes cloudy. As light passes through this cloudy lens, it cannot focus clearly on the retina, and objects look hazy or blurred. If you are bothered by dim, hazy vision from cataracts, your ophthalmologist can restore clear vision with cataract surgery. This is a very common procedure. This is when your eye surgeon removes the cloudy natural lens from the eye and replaces it with an artificial lens. During cataract surgery, your ophthalmologist will make a small opening in the side of your cornea. He or she will insert a pen-shaped instrument through the opening to reach the lens. This instrument uses a special type of energy to break up the center of the cloudy lens. Then it will carefully suction out the lens pieces. Your surgeon will then insert an artificial lens called an intraocular lens, or IOL. This IOL will stay in your eye permanently. The new lens lets light pass through and focus properly on the retina, bringing back clear vision. Once the IOL is in place, your ophthalmologist will close the incision, either with or without stitches. After surgery, a plastic shield may be placed over your eye to protect it. Surgery is the only way to remove a cataract. You do not have to have a cataract removed until it begins to affect your daily activities. Until then, changes to your eyeglass prescription may be all you need to improve your vision. Each year, millions of people find that cataract surgery improves their vision and their quality of life. If you have cataracts, discuss your vision goals with your ophthalmologist. Also, if you have any questions or concerns about your eyes or vision in general, don't hesitate to bring them up. Your ophthalmologist is committed to protecting your sight.
You may be thinking about surgery to replace your eye's natural lens with an artificial lens for better vision. This may be because you have a cataract or because you want to be less dependent on glasses or contacts. Whatever your reason, there are several types of lenses to choose from. These lenses are called intraocular lenses, or IOLs. An IOL is implanted permanently in your eye. It allows light to pass through and focus properly on the retina, restoring your clear vision. If you are having cataract surgery, your eye surgeon will remove the cloudy natural lens from your eye and replace it with an artificial lens. The most commonly used lens is called a monofocal lens. A monofocal lens provides clear vision at one range without glasses or contacts. Many people choose to have their monofocal lens set for clear distance vision. This usually allows you to do things like drive or play golf without needing glasses or contacts. Keep in mind that with a monofocal lens set for distance vision, you will likely need to wear glasses for reading or close work. Also, in some cases, you might need glasses to help fine-tune your distance vision too. If you want to reduce your dependence on glasses at all distances with a monofocal IOL, then monovision may be the solution. Monovision is when one eye's lens is set for good distance vision, while the other is set for good vision close-up. Your dominant eye is usually the one corrected for distance vision. Despite having a different focus, both eyes still work together for clear vision at most distances. With monovision, the eye that sees distant objects clearly will see close objects as blurred. The eye that sees well up close will see distant objects as blurry. The brain learns to adapt to using one eye or the other depending on the task at hand. If you are considering monovision, your eye doctor may recommend trying it with contact lenses first to see how well you adapt. It usually takes about 2 weeks to determine whether monovision is right for you. A monofocal lens is usually paid for by insurance as part of cataract surgery. There are other types of lenses that provide more vision options. They are called premium or enhanced lenses. If you are having cataract surgery, you will have to pay extra for a premium lens since insurance only pays for a monofocal lens after cataract removal. One type of premium IOL is called a multifocal lens. It provides clear vision at more than one distance. A multifocal IOL has focal zones or rings that allow you to see clearly at both near and far distances. That design means you can be less dependent on reading glasses. With a multifocal IOL, your brain learns to automatically select the focus you need for the activity you are doing. Your brain selects the appropriate focus for a certain distance while ignoring images from other distances. It may take a little time to adjust to this way of seeing. For instance, you will need to learn how far away from your eyes to hold a menu or book. But as you adjust, you may find you need reading glasses less often. Some people who have multifocal IOLs find they see halos or rings around lights at night, and their vision may not be quite as sharp as expected. For some, this is bothersome, while others don't mind. Another IOL option to help you see clearly at both near and far distances is an accommodative lens. An accommodative IOL is designed to move or change shape like the eye's natural lens, allowing you to focus at different distances. With an accommodative IOL, most people find they don't need glasses or contacts after surgery. However, some people may still prefer to wear glasses for long periods of reading or close work. As with multifocal lenses, some people who have accommodative IOLs see halos around lights at night, and vision is not as sharp as they expected. And some people still need glasses for reading or distance vision. For people who have astigmatism, there are IOLs called toric lenses. A toric IOL is designed to correct the blurry or distorted vision caused by your astigmatism. The toric lens helps focus light more effectively on the retina. A toric lens may significantly improve your distance vision. However, you will still need glasses for reading. There are new types of toric lenses that not only correct distance vision for people with astigmatism, but can also provide clear vision up close and at mid-range. Depending on the type of toric lens, glasses might still be needed at certain times for reading or close work. Your ophthalmologist will be happy to discuss your vision needs and expectations and help you understand the pros and cons of the different types of lens implants. If you have any questions or concerns about your eyes or your vision in general, don't hesitate to bring them up. Your ophthalmologist is committed to protecting your sight.
How to choose a vision correction surgery. I would say 5 things I would consider. Number 1, you want to make sure they're a board certified ophthalmologist, and you can check this online. Number 2, for the particular surgery that you're getting, let's say LASIK or SMILE, you want to check what kind of specific training, typically in the form of a fellowship, have they had, or have they had it, so you want to ask them that. Number 3, I would ask about their success rate, how many of your patients are happy with their results or achieved the vision that they were hoping to achieve. And number 4, it's an important one, I would ask the technology they have. There's not just one version of LASIK or laser or SMILE. There's many versions of them, so you want to check, do they have the most up-to-date technology and what specifically are they planning to use for you. And number 5, I would say, is the most important one. At the end of the day, this person is going to be your surgeon. You want to make sure you had an opportunity to meet them, you feel comfortable with them, they hear you out, they can listen to you, they can understand your concerns. And I would say that's the most important one. If you, at the end of the day, don't feel comfortable with that person, they should not be your surgeon.
When you had cataract surgery, your ophthalmologist removed the cloudy lens from a thin, clear capsule in your eye. Then he or she put an artificial lens in that capsule. Now that lens capsule has become cloudy, making your vision hazy or blurry again. This is a common problem. It happens when cells from the eye's cloudy natural lens remain after cataract surgery and start growing on the capsule. To restore your clear vision, your ophthalmologist suggests a procedure called YAG laser capsulotomy. The artificial lens implanted in your eye during cataract surgery is clear, allowing light rays to pass through and focus precisely on the retina. Eventually, however, the capsule holding the IOL can become cloudy. As with a cataract, when light passes through this cloudy capsule, it no longer focuses clearly on the retina, and objects appear hazy or blurred. A YAG laser capsulotomy is a brief outpatient procedure often performed right in the ophthalmologist's office. Your doctor will dilate or widen your pupils with dilating eye drops. He or she also may put numbing drops in your eye. With YAG laser capsulotomy, your ophthalmologist will use a laser to create an opening in the back of your eye's cloudy lens capsule. Light can pass through the lens and focus properly on the retina, allowing you to see clearly again. You should not feel any pain after the procedure. Your eye will still be dilated afterwards, so you will need to consider having someone drive you home. It is common to see a few new floaters afterwards. These small, dark spots or lines in your field of vision should decrease or go away in a couple of days. As with any surgery, there are possible risks with the YAG laser capsulotomy procedure. Risks of YAG laser capsulotomy can include bleeding into the front of the eye, swelling of the cornea, the clear covering of the eye, swelling of the center of the retina, retinal detachment, where the retina lifts up from the eye wall, short-term increased pressure inside the eye. You may need to use eye drops to lower the eye pressure, damage to your lens implant, and having the lens implant move out of position with a possible need for more surgery. YAG laser capsulotomy is the only way to improve vision from a cloudy lens capsule. You do not have to have YAG laser capsulotomy, but without it, your vision will not get better and may continue to get worse. If you have any questions or concerns about YAG laser surgery, ask your ophthalmologist. He or she will be happy to help you understand what to expect from this procedure. Also, if you have any questions or concerns about your eyes or your vision in general, don't hesitate to bring them up. Your ophthalmologist is committed to protecting your sight.
I'm Dr. Ashley Aoyang. I'm one of the optometrists at Coastal Vision, and I'm here to answer some common questions that we get from patients in our office. So the LASIK surgery itself is permanent. LASIK surgery or any other refractive surgery that we do does not stop the vision from changing or taking its natural course. So we're going to be able to correct your vision for where it is right now, but if your vision changes in the future, which for most patients it will, typically we can do a small touch-up or an enhancement to correct your vision for where it changes. So a surgical option that is reversible is the ICL, which is an implantable contact lens or the implantable Collamer lens. So it corrects your vision very similar to a regular contact lens. It's placed just below the surface of the eye, but it can be removed. So it's completely reversible for whatever reason. If you change your mind, if we need to take it out, we can completely take out the lens and there's no issues. So when you come in for a consultation, we do a very thorough, comprehensive evaluation of your eyes. So if your prescription is outside of the range for LASIK surgery, maybe your cornea is not quite thick enough for surgery, we do have a lot of other surgical options that are available, and we're really lucky right now to have a lot of different options, especially for patients that weren't necessarily candidates for LASIK in the past. I know a lot of patients come in thinking LASIK is the only option, but we actually, like I said, offer a wide range of surgical options to treat a wide variety of eye conditions as well as prescriptions.
The thing I'm most excited about with LASIK is the fact that I could just wake up every day and go.
Right after my surgery, I've noticed a pretty big difference. I had noticed that the symptoms that I had before started to disappear.
So since my ICL surgery, my vision has been great. I see clearly, everything's great.
Since I've had LASIK surgery, I've been able to focus more without having to worry about taking contact lenses out at night. It's very life-changing.
Thank you so much, everybody. My life is forever changed. Thank you, thank you, thank you.
Glaucoma is a condition of the eye.
that, if left untreated, can cause permanent damage to your vision. When intraocular pressure, or IOP, is higher than normal due to blocked drainage channels, pressure can be placed on the optic nerve, which is a part of the eye that is responsible for relaying visual information from the eye to the brain. That pressure can result in nerve damage, sight loss, and even blindness, which is why it's so critical to identify and treat glaucoma early. Finding the right treatment for you depends on the type of glaucoma, its severity, and your personal preference. Most patients begin glaucoma treatment with eye drops to lower IOP, but some can find them irritating or hard to administer consistently. Drops can also fail to lower IOP enough over time. If you are an adult with primary open-angle glaucoma who experiences any of these challenges, a minimally invasive option like the Omni surgical system may be right for you. Much like a clogged sink, blockages can occur at several points along the eye's natural drainage system. The Omni surgical system allows your doctor to work in multiple areas of your eye to remove the blockages that can cause pressure to build. As a result, Omni helps to improve the eye's natural outflow, lowering the pressure on the optic nerve and helping to preserve your vision. A minimally invasive surgery, or MIGS, is a safer, less invasive alternative to traditional glaucoma surgery. If your doctor considers you a candidate, a MIGS procedure with Omni may reduce or end your use of drops and can be done at the same time as cataract surgery or as a solo procedure with minimal recovery time. Are you ready to learn more? Talk to your eye doctor today to see if the Omni surgical system is right for you.
Hi everyone, I'm Dr. Maravasti. I'm a board-certified fellowship-trained ophthalmologist. I've been with Coastal Vision since 2019, right out of fellowship. Top 3 favorite procedures to do. Number 1 has to be cataract surgery. It's one of those things that no matter how many times you do, it's just like a puzzle that you've put together thousands of times, but each time is a little bit different, and something so satisfying about putting it together again. Number 2 has to be EVO ICL, and it's very satisfying to do because these are typically patients who've been turned away from refractive surgery. They've been told there's no option for vision correction for you, and sometimes right on the bed in the surgery they can actually see the difference, and that's really cool. And number 3 has to be LASIK. You know, it's one of those things that no matter how many times you do it, that wow factor of the patient just getting up from the LASIK bed and they can already see never gets old. The least favorite procedure to do has to be a sty excision. Just never liked it, ever. Yeah, I hate styes. That's my least favorite thing to treat.
My name's Bill. I'm 73. I'm a commercial licensed pilot. I'm also a columnist for my own magazine. The nighttime driving really was a stopper. Now I take for granted that I can read the signs, that I can drive at night. It does provide freedom. I think the panoptic lenses free you of compromise. I have near vision, I have middle vision, and I have far vision. It has given me confidence in my visual ability. My name is Bill, and I am a panoptimist.
Hi, I'm Dr. Stephanie Tran at Coastal Vision. What I love about being an optometrist is the ability to help people see better and improve their quality of life. What I love about being a part of patients' surgical journey is seeing them come in before their surgery a little nervous about what options they have, and then making that decision together, and then seeing the outcome and how happy they are, and just seeing their quality of life improve with the new vision that they have. Some tips to maintain healthy eyes is to have a good diet, so dark leafy greens, omega-3s, vitamins, also getting regular eye exams with your optometrist. Another good tip is to make sure you always wash your hands before you touch your contact lenses if you're a contact lens wearer, taking breaks if you're on the computer, and then wearing sunglasses when you're outside to protect your eyes from the UV. My favorite ice cream is coffee. Why? Because it tastes like coffee and I love coffee, but there's sugar now. And the weekend starts with beach volleyball in the morning, good smoothie, brunch, maybe some golf, and then dinner with people that I love. I'd be an eagle, because I can look down and, hunt and be the top of the food chain, but also fly and have really good vision. Eagle vision. Ah!
Hi, my name is Tracy and I live in sunny Mount Pleasant, South Carolina. I work a lot in front of many, many screens. I noticed I was getting closer and closer to the monitor. I have always been active, mostly biking. You have to be constantly judging near, middle, far, near, middle, far. I was beginning to have trouble getting all three, and to the point where if I wanted to clear up my distance vision, I could not see the odometer, period. I just didn't feel comfortable biking the way I did before. Just 1 month ago, I had the Vivity lens implanted, and I'm extremely excited about my vision. I remember just looking around at everything, kind of like you've got new eyes. I could see the trees, I could see texture in the leaves of the trees. It just feels more colorful. I had quit looking at the laptop monitor because it was almost impossible for me to make out the text on the screen. I now see it easily as well as I do the larger monitors. I can use it in my lap, so I can see it in all contexts now. The use of a cell phone was nearly impossible to read without some readers, and now I see it completely fine. Applying makeup is certainly one of the areas that improved greatly. It gives me hope that I can enjoy biking for a longer period of time. I just feel more comfortable, safer. It makes me feel more youthful. The Vivity lens provided a terrific outcome for me. I am very, very pleased.
What I like about the ZEISS SMILE Pro procedure is that it was so quick and it's like the most updated technology. During the procedure too, it was very clean, going into it. It was just fast. My journey with glasses actually started in middle school when I was 12 years old. We picked out like a free insurance pair of glasses and I hated them, so I never really wore glasses. I did take up tennis and that's what made me get into contacts, which I really enjoyed because the freedom from glasses and being able to see the ball and run to it, that like changed my life. I've honestly thought about it my whole life. My mom has told me from when I was like 18 that she's always wanted me to get laser correction to help me because I have the worst vision in my family. So it's always been in my mind, but I didn't really fully commit to it because I've always been scared of the incision that LASIK makes. When I did go into the consultation, learning more about the procedure too through Coastal Vision and Gina coming to visit our office, like that's kind of what made me interested in SMILE, and then the benefit of the dryness is what really pushed me to smile. When I woke up, it was crisp and clear. It was crazy because I thought I was wearing contacts still. It was really crazy because it's definitely life-changing. Like, to be able to wake up and see, to go to the restroom, it's like, it's a different type of world now.
You and your ophthalmologist have talked about refractive lens exchange, or RLE, to correct your vision and reduce your need for reading glasses or bifocals. With RLE, your ophthalmologist removes your eye's clear natural lens and replaces it with an artificial lens that provides sharper focus. After about age 40, your lens becomes more rigid. Because the lens can't change shape as easily as it once did, it's more difficult to read at close range. This normal condition is called presbyopia. RLE is usually done as an outpatient procedure, so you can go home afterwards. Before the surgery, drops will be put in your eyes to dilate or widen your pupils. Your eyes will be numbed with either eye drops or an injection of medicine so that you don't feel any pain. During laser-assisted refractive lens exchange, your ophthalmologist will use a laser instrument guided by a computer. The laser is used to make small openings in the side of your cornea. Then your eye surgeon will insert a pen-shaped instrument through the opening to reach the lens. This instrument uses a special type of energy to break up the center of the lens. Then it will carefully suction out the broken lens pieces. Your surgeon will then insert an artificial lens called an intraocular lens, or IOL. This IOL will stay in your eye permanently. The new lens lets light pass through and focus properly on the retina, bringing back clear vision. Once the IOL is in place, your ophthalmologist will close the incision, either with or without stitches. There are several types of IOLs to use for clear vision. Each one is different in its design and offers different advantages. You and your ophthalmologist will discuss your vision needs and expectations to decide which lens may be best for you. As with any surgery, there are possible risks from refractive lens exchange. Refractive lens exchange risks may include infection in the eye, bleeding in the eye, swelling of the cornea, swelling of the retina, retinal detachment, which is when the retina lifts up from the eye wall. People who are very nearsighted are more at risk for this. Pieces of the natural lens left inside the eye, increased pressure in the eye, drooping eyelid, seeing double, losing some or all of your vision, needing to have more surgery, and needing to wear glasses after surgery. Depending on the type of IOL you have implanted, some of the side effects or problems may include experiencing glare, seeing halos or rings around lights at night, seeing double or ghost images, seeing a black crescent shape in your side vision, having the lens move out of position, and the lens needing to be replaced. There are alternatives to having refractive lens exchange in order to improve your vision. You may be able to have another type of refractive surgery that reshapes your cornea, or you may be able to have an IOL implanted in front of your eye's natural lens, leaving your lens in place. Or you may choose to continue wearing glasses or contact lenses. You and your eye doctor can discuss your options for achieving better vision. If you have any questions or concerns about refractive lens exchange, ask your ophthalmologist. He or she will be happy to help you understand the risks and benefits of this procedure. Also, if you have any questions or concerns about your eyes or your vision in general, don't hesitate to bring them up. Your ophthalmologist is committed to protecting your sight.
So ZEISS is kind of the newest laser on the block. It's like laser 3.0 after PRK and LASIK. There's three main advantages I think of when I'm thinking of SMILE. Number one, less risk of dry eye. So for patients that either have dry eye or are just really worried about that risk, we tend to choose SMILE. Number two, it's a flapless procedure. And because of that, all these flap-related complications like a flap dislocation, a striae on it, infection on the flap, inflammation on the flap are out the door. So we don't have to worry about it. And number three is a lifestyle choice. For my patients that are really living an active lifestyle, we choose SMILE because it tends to preserve the structural integrity of the cornea because it does not create that flap.
Aqueous humor, or fluid, is produced and drained by the eye to ensure the overall health of the eye. The eye naturally drains fluid through the conventional outflow pathway. This pathway consists of the trabecular meshwork, Schlemm's canal, and the collector channels. Glaucoma occurs when drainage of aqueous fluid becomes blocked, leading to increased pressure in the eye. The trabecular meshwork filters the fluid during the initial stage of drainage, and with glaucoma, it gets blocked, restricting fluid drainage. Glaucoma also causes Schlemm's canal, a tube-like structure, to become narrowed or collapsed, further limiting the drainage of fluid. Additionally, the collector channels, small tubes connected to Schlemm's canal, can become blocked. Canaloplasty is a simple, non-implant procedure that treats glaucoma by clearing blockages and widening eye drainage pathways without removing or tearing eye tissue. During the procedure, tiny microperforations, or openings, are created in the trabecular meshwork, leading to improved drainage of fluid. Canaloplasty can also increase the diameter of Schlemm's canal by up to 3 times and clear blockages in the collector channels.
My name is Dr. Betsy Nguyen. I am a cataract and glaucoma surgeon here at Coastal Vision. I've been doing cataract surgery for close to 30 years now. In the past, patients were fearful of having cataract surgery because it took longer to heal. But now, the cataract surgery is only a 10 to 15 minute outpatient surgery. You might be able to see well after 1 week after surgery. And now we can even get rid of glasses for many of our patients with cataract surgery. Cataract surgery can be recommended to patients who have decreasing vision, that say they have difficulty with driving, they're noticing glare at night, they're unable to see well for their sports that they like to do. But also it depends on the patient's eye exam. When they come into Coastal Vision Medical Group, we give a thorough eye exam to make sure that qualify for surgery. Is it affecting their vision? Do they have any other diseases that can affect their vision? And we will recommend the best course for them. Patients are very happy after cataract surgery. Why? Because you are going to be excited that you can do the things that you want to do and to see the things that you haven't seen for the last 10 to 15 years. I did cataract surgery on my own family, my 2 brothers and my mother, and they all have amazing vision after cataract surgery.
My name is Deanna Kraft, and I'm going into my 4th year of playing professional beach volleyball. Clear vision in my daily life is super important. When playing beach volleyball, being able to see the depth, how fast the ball is rotating, everything, and being able to get up and play and have 20/20 vision is just, it's really amazing and something I didn't really think I was going to have. So clear vision has really impacted my life in a positive way. When I was looking at my different corrective options, I chose EVO ICL because when I came in for my consultation, the doctor recommended it with my corneas. So with EVO ICL, I got the option to, even if my prescription changes in a couple years, I can take it out and put it back in. But I thought it was really a good, happy medium when I was looking at corrective eye surgery. And after talking with my doctors, they made me feel really comfortable with it and gave me a ton of information, so I was able to research it beforehand. My experience with Coastal Vision Medical Group has been really good. All the doctors are amazing. They're so nice. They kind of feel like my friends. When I walked in today, I hugged both of the 2 doctors that I worked with because they're just so personable and they made my experience feel really like I was coming in and hanging out with my friends, and that they wanted me to, I knew they had my best interests at heart, so I really liked it. And so I think Coastal Vision has been a really positive experience, and I definitely would never go anywhere else. I would tell everyone to come here because the doctors are just so amazing.